boy Remoy George Phillip the first.
And this is Masculinity. Now we're gonna get into it pretty quickly, but first there's something we gotta talk about. Have you guys seen A Quiet Night?
Quiet Place?
Dude, Quiet Place. Have you seen that?
Is that the John Krasinski one?
Yes.
I hear it's like, people tell me it's either really stupid or it's really great.
It had me fucking shook.
Doesn't it reinforce like traditional masculinity and like I'm the man and I'm the father and I will say.
I was like, has Remoy seen this? Because we have to talk about this like today. It's like she's like, I need you to protect them. Yeah. She's pregnant.
I'm pregnant and I'm holding a child. I'm a woman. This is my job in the world.
I mean, she's amazing at like protecting. I mean, I'm no spoilers here, but she's like actually like very strong. But like her strength is never.
She's no Okoye.
I mean, of course not. But who is Okoye? I mean, Okoye is not even Okoye. Is Okoye? Okoye. Oh my God.
Wakanda forever.
Forever. So no, but like she never gets like thought of as like a strong character, you know. And she literally would be like, I need you to protect them, like. And like he will talk to the son and be like, your mom needs you, like you need to protect you need to
because you are a man.
Because you're a man, and it's just like it's crazy. And like the little girl's deaf, and she like wants to just go out and hang out, and he's like no, and it's like. I mean, the reason why she's not going out is because she's a girl, right? Or, I mean, it might be because she's deaf, but it's probably because she's a girl. And I'm just like, John Krasinski, like, I mean, they're booed up in real life. I just thought that it would be a little bit, I just wanted them to, like, play with, like, I wish that the little boy had been deaf and that he had been teaching her all this kind of shit, whatever.
Sure.
You should still see it. Anyway. Let's get into it.
So people don't know. If people don't know, John Krasinski is a very handsome man in real life. I saw him once. He was A, very tall, and B, surprisingly very handsome.
I don't know why you're surprised by that.
That's what everybody says to me, but I thought he was like dopey, you know, from The Office. You just translate it as like it's dopey, goofy, lanky, odd-looking dude. No, he's very handsome.
He looks like he looks good in real life. Also, upholding the systems of patriarchy, but that's fine. We'll talk about that another day. Anyway, so, you guys, you know that Mental Health Month just ended. But we definitely don't want to end the conversation just yet. So first, I'd just like to say that we learned a lot this month. We had our resident therapist, Justin Leoy.
Shout out to Justin.
Yeah, start us off with a good picture of what some men deal with in their relationships and internally as well, and why they're not likely to reach out for support and what it takes for them to actually get there. So we're continuing that conversation today to explore the ways that men can support themselves and each other. So we're very excited today to have Matthew Nahoum.
Shout out to man Matthew Nahoum.
Yay, awesome. So glad that our pronunciation game wasn't too far off.
I truthfully don't know the historic pronunciation. We've heard it as Nahoum or Nahoum. My brother and I have always just, I guess, copied our parents.
Yeah, whatever you guys say.
Yeah, Nahoum.
Okay, cool. Where is that from?
Turkey,
cool.
Oh,
awesome.
yeah, I love Istanbul. But that's a different conversation.
Never been, not yet.
Ooh.
One day.
Let's all go together.
Yeah, I really
seriously?
want to go.
Yeah, there's a lot of cats there.
Yeah.
A lot of cats. There's a documentary about the cats of Istanbul.
Really?
I think I've heard of that, actually.
Anyways.
So Matt, you're the founder of Integrated Creative Therapy here in Brooklyn, which provides art therapy for your clients. So first, just thank you for being here on the show.
Thank you guys for having me.
Awesome. So before we go any further, I mean, I have an idea of what art therapy is. I can kind of conceptualize it as like my Samantha brain would, but what is from you art therapy?
It's, I guess if you ask 20 art therapists what art therapy is, they all have a different answer. I personally don't love the word art specifically because it's intimidating for people who don't think of themselves as artists or creative or anything like that. I think I like to use the term metaphor. I'm a metaphor therapist, art being one of many metaphors. It's more about creative expression. Think about acting, right?
Yeah.
Role playing. It's easy to say something that's kind of actually on your mind in a persona. Versus, because you're like, oh, whoa, no, I didn't say that. The persona said that.
Yeah.
So when you're making a drawing, you're making a movement, you're making music, not only can you safely hide in the metaphor, that's where the subconscious loves to hang out. So the things that are at the conscious level can be expressed there very, very, very safely, but things from the subconscious can also come out. Many times art therapy is not about diagnosing via art. It's not draw me a picture. Oh, I know exactly what's going on with you. I mean, there are indicators and things like that, but it's more, wow, tell me about that.
Right.
And then a great tool that we use as art therapists is reflection. Wow, that makes me feel this way. And I can't tell you how many times clients suddenly go, oh, whoa, I didn't even think about that. Oh, shit, you're right.
Yeah.
It happens all the time. So that's where, art, creative expression of any kind allows for both the conscious and subconscious to come out versus traditional verbal psychotherapy,
Sure.
which is thought through. Maybe now and again the well-known Freudian slip happens where sort of that like subconscious kind of comes out, but you think more about what you're going to say and it's a little more filtered.
Yeah.
Now with art, you've got more of the subconscious coming out, and then you've got the safety of the metaphor to live in,
Right.
to exist in. So I think from a modality standpoint, you've got traditional social workers and psychologists. What makes an art therapist like myself, I think, skilled, extra skilled, is I've got a very big toolbox that I can use. And maybe you don't feel like talking today, but there's something going on, something on your mind. There are other ways that you and I can work together, or a client and I can work together that will allow you to still express what's going on in your mind and get what you need instead of just sitting there staring at each other. This works really well with populations with people who are not very trusting. It takes a long
Sure.
time to trust me, some random guy.
Well, I think what's interesting is what you're saying, or what I'm perceiving is it kind of lowers people's defenses without them realizing it, and then they participate in something, their defenses are lower, they aren't as guarded, and for the moment, and then you have the opportunity to really open them up to something that they may not have seen, whether it's right there on the paper or the canvas or whatever, or it's a little bit more underneath, a little bit more unconscious or subliminal.
Exactly.
But I got to be honest here. The Remoy of 10 years ago, when he would have heard art therapy, would have kind of been like, what? And just kind of laughed. And probably the same thing if you just said therapy to me, And I'm assuming you get a little bit of the same pushback regularly. How do you kind of overcome that or speak to that?
Yeah, I mean, there's less pushback and more question. Or, well, I'm not a good artist.
Sure.
And that's why I mentioned not really in the art word. I'll invite a new client in, or in a group situation, try to bring a new client in, and they're like, I'm not a good artist. Well, it's not about that.
Right.
That's why I think when I talk about things as more metaphoric, then it sounds a little bit more doable. Some of my clients will say, actually, can I write a poem? Absolutely.
Let's go for it.
I always have out collage materials. Collage materials can be very...
I love collages.
Collaging is so much fun, and it can be really expressive and really interesting without challenging your artistic ability or you needing to feel confident in having an artistic ability.
You don't have to draw a straight line. You don't have to color in the lines. You just got to put some pieces of paper, cut them out, and put them together.
And you know what? Magazines have big words. So people, not even pictures, they cut out big words and play them around on there. And it's so telling. Why did you choose that big word, this big, versus I see another word that's similar that's a little bit smaller? So why did you put that bold? Why did you put that underline? So
it's fun.
It's, again, it's not diagnosis. What it is it allows me to ask questions and reflect feelings because you do the work.
I'm going to art therapy. This is shit I want to get
Come
into.
to art therapy. It's very enlightening. I find that people have a little moment of wow, and then they don't show up to their next appointment.
Wait, why? Why would you not show up to your next appointment? Because it sounds like people are getting really to express themselves in a way that they obviously haven't before, and why wouldn't they show up?
It's incredibly vulnerable.
Yeah,
it's confronting.
When you have that revelatory experience, and then you're like, you may enjoy it in the moment, but then afterwards you're like, whoa, that was a little too much. Or
I
a lot
am
too
naked.
Much. Yeah.
You allowed me to go to that metaphor. And that metaphor stripped down all of those defenses that I've had put up, and now all of a sudden, it's like, like you just it's this feeling of vulnerability that a lot of
Especially
people.
for men, that's my hand is raised. Exceptionally challenging. Again, great experience at the moment. Do I want to put myself in that position again now that I think about it? Nah, bro, I'm cool. Like,
Yep.
let's chill.
Well, I mean, it sounds like you have 2 new clients.
Awesome.
So recently, we had Dr. Obari Cartman on the show, and we didn't get too into it, but he did mention that there's an added opportunity for men to open up when like there's some type of body work involved. Now that you've actually described a little bit more about what art therapy is, it's not necessarily body work per se, but it sounds like it can include some of that. Playing music, maybe. I'm curious as to the impact of these forms of art when it comes to helping men specifically overcome some of the issues with traditional masculinity, right? Like kind of bottling things up, So specifically this notion of performance of masculinity that we keep on talking about here on the show, as compared to freedom of expression. Can you speak to that?
That's where the subconscious comes. We as men are products of how we were taught, right?
Absolutely.
Especially as it relates to masculinity in particular. Cultural, ethnic, societal, city, state, rural, all of these things factor into it.
They inform from all sorts of areas that are informing the way that we perform our masculinity.
Exactly, and how we view what we view as masculine. We portray what we think is masculine, not so much as what we think other people will think is masculine.
Sure.
I just saw a Facebook argument going back and forth, and it was really, really amazing. And this one guy arguing with another person said they were talking about hollering at women. And he said, my father hollered at women, my grandfather hollered at women, I holler at women. And I was like, what a painful thing, but what a beautiful way to express this. You just told the world why you do what you do because it's what was taught to me is right. So in art, again, being that safe place or movement or music or poetry or writing, being that safe metaphoric place, we in this society, in this day and age right now, I don't think people are ignorant of the discussions that are going on. Some of the discussions that are going around masculinity, around gender, around sexual orientation, around restrooms, around all of these things.
Sure.
They're not seeing it, but it's contrary to what they were taught, what they grew up on. Now, if you confront them directly, calling out, you're wrong, and your dad was wrong, and your friends were wrong, and everything you know is wrong, you're going to get defenses immediately shooting right up. And then there can be no learning. There can be no understanding, education, empathy. There can't be any of that. So art being that safe place to sort of explore things that maybe are taboo or contrary to what they believe, but what they're hearing.
For what they learned, what was modeled to them.
Exactly.
That's a great way of putting it, that instead of it's not an attack at who you are personally, but it's attack on everything you've learned and who taught you what you learned and so on and so forth, and those traditions of said learning. And I think this is important because in a previous email, you mentioned that you kind of facilitate a men's group where topics are focused on men's issues that need to be discussed in a non-judgmental space, and that is huge. Can you talk about the importance of that non-judgmental space, especially for men?
Yeah, absolutely. Besides working with integrated creative therapy, I'm what's called a recovery specialist. I work at an outpatient mental health clinic in the East Village called East Village Access, and it's a PROS program, PROS being personalized recovery-oriented systems. It's a realistic way of empowering our clients who suffer chronic mental illness to take ownership of their life, choose their goals, and then we allow them the space to learn how to better reach those goals and work towards those goals and things. And with my role as a recovery specialist, I work individually with clients, and I also do groups, and I run this men's group. Men's group and my art group there are two of the and I'm not patting myself on the back on this, I just think that the discussions are that important. I have up to 18 people in a group, and most groups are only about 8 people. The men's group is a safe space to talk about men's issues without judgment. I start the groups by reminding everybody there's no judgment here. That said, we need to watch what we say terminology-wise and things like that because we want this to be the safe space for us to talk. And we explore a variety of issues from men's health, taboo things like erectile dysfunction. Some of these psychiatric medications, the antipsychotics, have sexual ramifications.
Right. And that's debilitating for men.
It is. You don't feel like a man if you can't get it up. It's frightening. And this is a place where we allow the safe discussion of men's topics. A lot of the topics are around women and interacting with women because these men who come from a variety of backgrounds, but a lot are poverty-stricken, lack of education, homeless, substance abuse is rampant. They didn't learn. They don't know what's appropriate to say, and they need a safe space to be told maybe that's not the right way to approach a woman, and then have other people sort of share more appropriate ways to talk to women, to talk to potential mates. And all of the men in my men's group just happen to be cisgendered men. But I am very careful of the terminology I use. Often they will use women, but I want it to be safe to people who identify in various ways without having to force them to say, I date men or I sleep with men or something like that. So I say a partner, I say people, I say folks. I don't say guy, dude. I try to avoid that terminology for two reasons. One, to create that safe space, and second, to model what it is to be aware of other people's situations, other people's needs. And that's that non-direct, non-defensive way of educating people. I'm not challenging what they know.
Or what they've learned or how they've learned it.
Or what they've learned or how they've learned it. I just show them what it is to be aware.
Right.
And if there's that modicum of awareness, that tiny little bit that changes in one person, then we have changed the world. As far as I'm concerned, if one person changes their behavior in a certain way or the way they talk in a certain way, even though it's not the way they were raised, the way they were taught, or the environment or community that they go back to. Some of these guys go back to some of the toughest homeless shelters in New York City, where many words are very appropriate. And they go back there, and now they're a little bit more aware of what they say and who they say around and things like that.
Absolutely. That methodology of like creating a safe space, not only to, speak to issues that may be bothering you, but to learn a new way without judgment, without judgment is huge. To potentially to take the pressure off, to perform something, but then also to say I don't know or I don't understand, or to be open to learning is huge for anybody, especially men.
Yeah, and so one of the things that we've been talking about is modeling, right? And it's like what I heard in what you said is that there is a modeling of what's possible as a departure from how things have always been, which I find really powerful. And one thing that I also wanted to mention is what I wanted to run by you is you mentioned something earlier about, the way that people have learned to be their whole lives. And, as we go through all these political things and stuff, there's the right side and the left side and all of that. And, I think that as an idealistic, college student, I always used to think oh no, people just don't know the facts. Otherwise it wouldn't be okay with some of the injustices that go on. And fast forward to today, if it's very clear that people just choose a side that they want to align on and move forward with that. So I guess my question is is there a way that people are able to, your clients are able to then take what you've done and model it for the people in their lives?
Yeah, there are tons of ways. I think part of what we do at East Village Access is that we foster a sense of community where clients together, hanging out, socializing. I don't want to use the word police, but sort of they maintain the space in a lot of ways. And we try not to get involved unless it's necessary, unless somebody's really, creating a disturbance. So a good example of, I think this is one of my favorite clients. He's born and raised on the streets of Baltimore. Long incarceration history, foster care. He's been in the system since he's born, pretty much. Mental illness, struggling with all sorts of things, violence, drugs, you name it. And he's got an inherent homophobia from his time in prison, from his time on the streets and stuff. And we had another client who's transgender who now identifies more as GNC after taking hormones, still kind of grows facial hair. And somebody said something to this person in a derogatory way. And this client from the streets of Baltimore, who says very homophobic things sometimes, stood up, was not urged to, but felt the importance of standing up, looking at this other person and going, she's a very nice, beautiful young lady, and you treat her that way. And we weren't even, we heard about it from somebody else. And yeah, that hair on your arms, it not only breaks my heart, it fills my heart. That the education that he's getting, the learning that he's getting from working with us, he was able to see modeled for him and then model for the rest of the community without being asked to do so. He could have sat there. He didn't need to. He's got some homophobic views. Mm-hmm. He could have joined in. He could have done all of these things, but no. He stood up and stood up for her. Oh. And those are the things that help us to see how this works. Yeah. How this non-confrontational, this educational, this dialogue, this facilitated way of approaching masculinity, just being a human being, works so well. And the people with mental illness, with chronic mental illness, that also have these other comorbid diagnoses and issues and stuff, they go back to these places where the things that they're learning are not necessarily able to be implemented or not culturally utilized.
Sorry to interrupt. What's comorbid mean?
Happening at the same time. Comorbid.
I think a morbid, like morbid.
Morbid. I'm sorry, using psych terms.
No,
comorbid, they usually use that with, especially with dual diagnosis or what's now known as co-occurring disorders, which is mental illness and substance abuse.
Okay, got it. Thank you.
But I think that this type of environment is how I think we need to talk to each other as men from various cultures in this really, really difficult place that we're in right now, politically and everything, from a place of non-confrontation, of discussion. The problem is there are a lot of hot button topics that that create emotion from people, like very powerful emotion. And unfortunately, sometimes that powerful emotion can be a little bit of a barrier because it can put people on the offensive and defensive. And that's not an environment where people are going to feel comfortable in being vulnerable. In saying and being, you are right, I was taught wrong. To use the F word, in talking about someone's sexual preference. That's how I was taught. That's how I was taught in jail and on the streets and whatever. But you're right, you're a human being. And I shouldn't use that, and if you're aggressive against somebody or defensive, it puts up walls. And then the walls prevent the education and the learning and the sharing and the growth. What do walls do? You put a cocoon around something as it tries to grow, it can't grow. So those walls need to come down for growth to happen.
Yeah. So on the show, we've consistently actually talked about vulnerability and vulnerability as powerful rather than as weak. And so I think that a lot of times, we've talked about how a lot of times it is perceived as weakness, right? And so I just wonder, it seems like a huge part of self-actualization to be able to be vulnerable enough to kind of accept yourself as you are. And so I just wonder in your work if that exact conversation ever comes up. I mean, I understand that like mostly it's about fostering an environment where things arise rather than being very directly like aggressive about making things happen.
Mm-hmm.
But I just wonder like if you have that conversation about vulnerability as strength, and rather than as weakness or like how that might look.
So, yes, absolutely. In the men's group, I will say, what's it like to be vulnerable? What's it like?
Uncomfortable.
Uncomfortable. Very. Especially for folks with chronic mental illness,
Sure.
because there's the fear of being
so
stigmatized.
Much judgment out there.
There's so much judgment. I take two different approaches. I take a direct approach and just ask that. What's it like to be vulnerable? Or maybe somebody will talk about something that kind of describes their feeling vulnerable. And part of a skill as a facilitator is to bring the group into the expression of something somebody said. I may say, you just expressed something about, and wow, that you must feel really vulnerable. Guys, can you think of a time when you felt like that person did?
Oh.
And if they're willing to go there, they will. I always know who's in the group and who's a talker and who doesn't mind expressing, and I may ask them directly, so tell me about that. Remoy, tell me about that time when you felt that way, and it continues to be cohesive. Other times when in an art group specifically, there's a directive I do often that's a shield. So I cut out a middle, a sword and shield and stuff, and I ask them to decorate the shield with the things that protect them from feeling vulnerable.
Deep.
And and I can reflect lots of things like if somebody just piles it on, it's like, wow, that shield, that defense looks really heavy to carry around all day long. What would it be like to put it down for a minute? In this room with these people, can you put that down because it looks really heavy? Or is there anybody in the group that wants to help her hold that really heavy shield? Again, there's the metaphor. We're talking about how heavy it is to be defensive all the time, to try to protect yourself from being vulnerable all the time, and it's exhausting for people. So if somebody says, I'll help you hold that shield, you've got someone who's metaphorically allowing you and granting you permission and saying they will protect you while you're vulnerable.
Wow. I mean, that's incredible.
No, absolutely.
And wow. So, I mean, how do you even come up with that? Like, how did you even think to, you come up with all these very specific exercises to do that are like a direct metaphor for how people are feeling inside? Like, that's amazing.
I'm an artist. I'm a painter. I love metaphor. I just find metaphor really interesting. I find metaphor all over the place. I watch Lord of the Rings. And
I was about to say,
I totally watched Lord of the Rings and saw the dwarves carrying heavy shields, and I was like, wow, that's a shield of invulnerability. Vulnerable. I also worked.
Tolkien.
Still haven't watched those. They're way too long, but anyway.
So good. I've also worked in some really challenging places. You mentioned, Remoy, a word that is part of my personal identity is being uncomfortable. I'm also a faculty member at the Pratt Institute, where I got my master's degree in the art therapy department, and I teach a supervision class. I also have interns of my own, and I learned a very, very difficult way how important it is to be comfortable being very uncomfortable. I've been in situations with clients who have told me some horrific things that made me so uncomfortable that I had to put that discomfort away and address it later on. Put it in the parking lot. You can't think about this right now, because then I'm in my head and I'm about me. I'm not about that person. So I think, I learned the hard way, struggling to be comfortable being uncomfortable, and that allowed me to get more creative especially in the setting that I'm in now, be it private practice or community access, because these clients want to be there. They're less resistant than when I worked in the Atlantic Center men's shelter on Atlantic and Eastern Parkway or an inpatient psych unit in the Bronx. Those people did not want to be there. And it was, you have to get really creative in ways that will reduce the resistance they are to you, to the therapy, to being therapized, to all of these things. Yeah. And I guess it's just experience. I still falter, but that's where the learning takes place. I tell my clients and I tell my students all the time, make mistakes. Fall forward. Just don't be afraid to fall, just fall forward. Learn from that mistake. Learn from the situation. Full of metaphors, but I say all the time, progress, not perfection. All we want is progress. We want you to move forward in your life or in your education or in your experience. Don't ever expect perfection. That's too much pressure on you. That's something that may not be able to be achieved. You have these small levels of achievement. Wow, I have made progress. I tell my clients all the time, think about where you were 6 months ago. And they can't see it until we discuss it. And then they go, wow, I really am. And it becomes motivating.
I'm definitely stealing progress, not perfection.
Do it.
I'll coach you every once in a while.
I appreciate it.
I do want to transition here, and I hope we can use like some of your tools as a recovery specialist to kind of analyze this. But I want to think about the correlation between masculinity and addiction. This is super important to me. I mean, I've smoked for, I think, like 15 some odd years almost. I had a really serious problem with alcohol addiction. And when I look back to when I was like a little kid, I see all these connections between masculinity and addiction that informed the way I thought I was supposed to be a man, right? Like you had to be a tough man who smokes like cigarettes and who drinks whiskey straight up, or who like just throws down Bud Lights while watching football with his friends. Like there's so much like information or informing of the connection of masculinity and potential addiction. In the work you do with men and addiction, do you work to highlight to those clients those like masculine narratives that potentially push men toward these addictive tendencies?
Yeah, definitely. We, by exploring who modeled whatever for you, masculinity, manliness, fatherhood, life, there's often correlations between the people that modeled this for them and some type of an addiction. Some people pick up a beer. Their first beer came from their dad, and or dad passed out and they grabbed the joint or the bottle or whatever it is. It's interlaid for a lot of people in there that it's okay. It's modeled on TV for them. It's modeled, the Marlboro Man. He died of lung cancer.
I mean, a lot of us were raised up on TV, whether our parents were out of the house or whatever. So for me specifically, it was like TV, movies, everything, music. It was all about drinking, smoking, drugs. Not that it's like you have to go do it, but that was the modeling, right? It's like these are the people that are doing it, and this are these stories that I'm following, so naturally.
These are the people that I want to be, rock stars. I mean, but the interesting thing is, these men who suffer from addiction will go to that place where they want to tell you that's not the reality.
Yeah.
Guns N' Roses, Yeah. Slash didn't end up on the Lower East Side on the streets pulling water out of a puddle to fill the syringe.
Right.
They know that that's not life. And it actually, especially with addiction or with sobriety, as people find levels of sobriety through harm reduction or through complete abstinence, there's a desire to tell their own story, to teach. And then we embrace that. And again, going back to the idea of modeling, we ask this person what it would be like to tell someone else what it's like to be a man and a sober man, a man who's been on methadone for 10 years, or who got off methadone or hasn't had a drink in 10 years or whatever it is. And it can be very, very empowering. I find telling my story with addiction, because most people with some type of an addictive history have a story to tell, or they believe that they've got a big story to tell, can be very empowering for them and help them feel like they can help other people avoid the stuff, the crap that they had to deal with. I didn't have to do this, but I did it anyway. I'd like to be the person that helps you not, or to realize that you don't need to do this. I'm not your dad, but I'm telling you from experience, look, I have no teeth. You shouldn't be doing this.
That's like so profound. I think when I hear stuff like that, I just think about like all of the defense mechanisms that humans put in place to be separate from one another because they don't want to be vulnerable. But underneath it all, how like we're actually very much like invested in other people's well-being, and like I think that's one of the reasons why we wanted to do this show, because it's kind of like we think about the performance of masculinity as something that is, well, if it's a performance, obviously it's not inherent. But before we distinguish it as that, it's an inherent thing that men and masculine identifying people are doing to protect themselves, essentially, to kind of shield themselves from the world. And it's like underneath all of that, if you can highlight the impact that our like core selves are facing because we refuse to like let ourselves open up, I think we'll really get somewhere. And I think like, I guess.
Well, that's a great point. I just want to say, maybe in some situations looking at masculinity as a defense mechanism in a lot of ways and a protective factor is really may help us sort of change the way we approach education about masculinity, looking at it as a defense, like I had been saying about confronting it head on and a little too aggressively rebuilds those walls of masculine, you want to go outside, something like that.
Mm-hmm.
So I think that if we as a people, as groups, start looking at it in that way as more of a defense, not just a choice, we may be able to have the dialogues that are important, that are necessary.
So actually, I want to kind of make a link here, because I was talking to somebody recently, and we were talking about like the rate of suicide among men, and he was like, well, I guess it weeds out the weak men. And I was like, what are you saying? Crazy, And so in line, actually, we were just talking about addiction, just to kind of bring it back to that for a second. It's like, that's super judgmental. It's unhelpful. It's like, he was making a joke, but he didn't realize like the impact that way of thinking has actually on people who will actually just kill themselves because they're not accepted. So how do you cultivate like that healthy conversation about addiction that isn't demeaning or judgmental? And also, how do you cultivate just a healthy conversation about like being a different type of dude, or like, like how does that work?
It starts with their story. That's why AA, with their idea of, hi, my name is Matt, I'm an alcoholic, is so important. It's sort of like the foundation of what they're discussing. So allowing people to sort of begin to tell their story. Will tell you why they started using, or what it was, a traumatic experience, or someone modeling, or never being taught how to deal with a difficult experience or trauma or something like that, or having no supports for that. And then I think what else is important is, especially if you allow a minute or 2 minutes of introduction for each person in the group, you find it goes back because there's connection. As a facilitator of a group, the best groups are groups where I don't say a word.
Right.
Where they go and they support each other, and it's like, I can't believe you just said that, because that's me. And there's that moment of connection and then support, and then that fosters that environment of safety, of understanding, and which will start to allow them to start going to the really vulnerable places about where their addiction comes from, especially as it relates to trauma. It's trauma, there's so much shame, especially for men.
Yeah, let's push here. Let's talk more about this real quickly, like the trauma being part of the root system or the impetus for said addiction or dependencies.
What do drugs do? Drugs and alcohol make you not feel.
They sedate.
They erase, in a lot of ways, the memory, the feelings of the memory. And then what else? The other thing that it does is it creates something much more important than the pain. It's the addiction, the desire for more. So when I'm high, I don't feel a thing about this traumatic experience for me. And then when I'm not high anymore, what's the only thing that matters? getting high again. So that's why, sex workers addiction is so high in sex workers, because they're able to do these really difficult things for money and not think about it. Because even if they're not high during this act that is so traumatic,
they can focus on just the process of getting more of said thing.
Exactly. So
Sure.
it's a
So the
double
mind
edge.
is constantly like distracted from either the trauma in the past or the current trauma that's happening.
Exactly. Yeah. And then strip away the addiction. And part of addiction therapy starts with that vulnerability. And unfortunately for a lot of people, part of what happens with a lot of relapse is it's too much. They have to not only readdress the thing, they have to readdress the thing and what happened in the 20 years since the thing.
Right.
That domino effect of really difficult things that they've been through. And then they sort of need to come to grips with it, at least be able to acknowledge it, to be able to move on. Sometimes it's just too much for them and they fall back. And that's why, sobriety doesn't come until the person is really ready. And it's not just ready to be sober, but to be ready to be sober with pain. To be able to find other ways to cope with this mental, physical, psychic, emotional pain that they're going to have to feel, that's been waiting in the back of their mind for however many years.
As we start moving into closing this conversation, how do you recommend, or what would you recommend people finding any sort of support, whether it is for addiction or if there's some people that are inspired by the potential for art therapy in their place, whether it's in New York or elsewhere? How do people find these kind of services or solutions? Particularly men or friends of men, partners of men who are like, I have somebody who really could use benefit from this.
Well, with social media, it's great because you can find it. Hashtag men's support group. From an administrative standpoint, Psychology Today has got a great listing. The website, you can actually list by modality and insurance company and all that stuff, and we as therapists will list ourselves there. And but from a grassroots perspective, explore. Find a place that you feel comfortable in. Possibly. I mean, nobody's going to walk in the door and 5 minutes in be like, oh my God, this horrible thing happened to me.
Sure.
Find a place that you feel could support you. Could be a meditation group. Could be 12-step. It could be, find the things that are important for you to feel comfortable. Anonymity, or maybe you need, wow, I haven't worked in years and I just need services. You can start at Social Security and places like that. But just by beginning the process, by saying I need to find a place, I think can begin the journey. If you don't find it, it's probably because you're not really ready. Maybe you're shooting stuff down. Oh, no, I can't do that. I'm not going to AA. I'm not an alcoholic. I know people who are not alcoholics and don't consider themselves addicted to anything and don't need AA, but go to AA because 12-step is important and 12-step works for a lot of people. Some people may find it in church or in a place of faith.
Right.
You might just find it in your social circles or the outskirts of your social circles. You may find someone else who you have heard has been depressed about things, and maybe they're waiting for someone to reach out and be that person to say, I'm willing to hold that shield for you as you put it down and be there for you. And maybe you two can start a men's group, a discussion. It could be at a coffee shop, it could be wherever, and say, we need to talk about this.
Right.
And I think that's a good place to
No,
start.
that's perfect and helpful. Where can people find your services or anything that you're involved in or keep up with you?
You can find all my social media on integratedcreativetherapy.com. You can find out about the services East Village Access Pros offers on the communityaccess.org website. We do supportive services, educational supportive services, housing services, things like that. So check us out there.
Awesome.
Thank you, guys.
Great. And so we'll actually be posting all of your stuff on our social
Awesome.
media.
Thank you.
So just want to thank you so much for your contribution.
Thank you.
For
Such a fun conversation.
Yeah.
Thank you so much.
Yeah, I had
like
a
it was
blast.
just, it's like, yeah, thank you for the work that you're doing.
My pleasure.
And yeah, you guys, thank you for listening. So we're, like I said, we're going to be posting all of this information on social media, which you can find at Masculinity Pod on Twitter and at Masculinity Podcast on Facebook. Always spelled with a K.
I'm flexing right now. It's not much, but shut up. Stop laughing at me.
I'm just, okay. So, and our email, of course, is masculinitypodcast@whoistheo.com, of course, with a K. So, you guys, thank you so much for listening. Please let us know how you feel about this conversation. My name is always Samantha.
My name is Remoy George Philip V first.